Health. It's the state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. And good health is something we strive to achieve, not just individually, but also as a community. But if we look around us, our family, friends, and others, we know that health is very variable. For example, in 2016, the life expectancy of a child born in Sierra Leone was 53 years, while in Australia, it was 83 years. But even within Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. And even within a specific group of people, health can change based on a person's income, level of education, or occupation. So why is health so variable? To answer that question, we must understand the factors that influence health. The factors that influence a person's health are called determinants of health. These include who they are, such as age, sex, and genetic makeup, and what they do, as in health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, grow, live, work, and age, collectively called the social determinants of health. The social determinants of health are shaped by the distribution of money, power, and resources at an international, national, and local level. These can lead to health inequities, which is the difference in health between different groups of people that is unfair and avoidable. Let's take a look at the social determinants of health using a framework developed by the World Health Organization. According to this framework, there are two broad groups of health determinants: structural and intermediary. Structural determinants are the socio-economic and political context that people live in. It includes governance, economic, social, and public policies, and also the social and cultural values placed on health issues. These factors can lead to the unequal distribution of material and monetary resources, which can shape a person's socioeconomic position. Socioeconomic position is characterized by education, occupation, income, gender, race or ethnicity, and social class. The structural determinants of health operate through a set of intermediary determinants that impact a person's exposure, vulnerability, and outcomes to factors affecting their health. These include material circumstances, such as the quality of housing, the financial means to buy healthy food, clothing, or other requirements for healthy living, and work environment. Psychosocial factors, like stressful living circumstances, relationships, and social support. Behavioral and biological factors. In addition to these, health systems determine the type of healthcare, the quality of it, and how easily accessible it is. Bridging the structural and intermediary determinants are social cohesion and social capital. The links between all these determinants are not always linear, but can be complex, interdependent, and interact in many different ways to influence health. For example, poor income can limit opportunities for achieving good health, and conversely, poor health can limit opportunities for people to participate in the workforce. And remember, these determinants can act across the course of a person's life. So, the next time you think about a health issue, consider not only who they are and what they do, but also the conditions in which they are born, grow, live, work, and age. Because if we understand and act on them, we can build a healthier world for everyone.